This is Todd Anderson, and it's somewhat controversial. There's a local doctor, Dr. Myron Glick, who has just returned back to Buffalo after a 2-week stay in West Africa, and he's monitoring himself. There's obviously a Ebola crisis in West Africa, such that people there are dying, and there have been a few cases in the United States. So with that said, Dr. Glick is monitoring himself, and he's working with the CDC. But the question of quarantine arises. So we did a poll and asked WBLK listeners if they felt Dr. Glick should be quarantined or if it's satisfactory that he's monitoring himself. And this is what Dr. Glick had to say. Now, the first question I asked him was how the self-monitoring works.
Every morning and every evening I check my temperature, and then I let the local health department know what my temperature is. And then throughout the day I monitor myself for symptoms. So far, I've been healthy. I'm not having fevers or headache or diarrhea or vomiting, that kind of thing. So it's really the protocol that the CDC has established for re-entry from West Africa into normal life here in the States.
Now, I thought the protocol was that if someone does enter back into the States, it's automatic isolation, quarantine.
Well, so what you're talking about is what Governor Cuomo decided to do on Friday, and that was a decision that wasn't based on the science. It's not what the CDC was recommending. It was a decision that I think was more based on fear and the political expediency of the moment. That situation, though, actually doesn't specifically affect me because my risk in Sierra Leone was low because I was not actually providing medical care directly to Ebola patients. My purpose for visiting Sierra Leone was to encourage our medical team there that's doing medical work, primary medical work, not Ebola treatment, and to help them design a system that was safe to evaluate patients and protect our team. So I was providing technical assistance and training. I wasn't actually providing medical care. The quarantine that Governor Cuomo has instituted is for medical doctors and nurses who are treating Ebola patients.
Oh, okay. I understand. Now, tell me what it's like in West Africa, in that part of the world. What was your experience?
Well, I've been there many times, and when I went back this time, in some ways it looks the same. People are living their lives, they're in the market, they're farming, they're, doing normal things. It's not like we're seeing Ebola patients everywhere we go. It's not like there's bodies lying on the street in most situations. So just the first impression is it looks pretty normal. But then when you start to talk to people and you realize what's happening, it is a big challenge. The whole country is under martial law. There's a curfew. Motorcycles are only allowed to go until 7. People have to get off the street by 10. No one's allowed to hug each other or shake hands.
Really?
You have to wash your hands with Clorox every time you go into a public place.
Wow. Schools
have been closed since September. So people are really living under martial law right now.
Wow, that's pretty amazing. I guess I have to ask you this question: Are you afraid?
Well, the situation. I guess the other thing I want to say is in Sierra Leone and Liberia, people are really suffering who get sick from Ebola, and there's very limited resources for them to get the care that they need. So, thousands of people are dying, and their families are being quarantined. A lot of times there's no food to feed them while they're being quarantined. There's not enough burial teams to bury the dead. There's not enough hospital beds for the sick to be in. It's a real humanitarian crises in these 3 countries right now. So when I was there, honestly, I didn't feel afraid because I trusted the people I was with, and I wasn't actually providing medical care, and I know Sierra Leone well. But I can understand people being afraid in Sierra Leone. What I can't understand is people being afraid here. And so this it's sort of crazy that I come back and suddenly every person in Western New York media wants to talk to me, and we're making such a big deal out of this because honestly, there's nothing to fear here, and there's everything to fear in West Africa.
So in saying that, it sounds like you are 100% confident that you don't have Ebola.
I mean, what I am confident about 100% is that today I'm not in danger of being contagious to any other person.
Okay.
I mean, I'm at home with my wife and my 4 children, and I'm here seeing patients and I'm interacting with colleagues. And so I would never do any of that if I thought there was even a shred of a chance that I was actually contagious today. I mean, I can't say that I'm 100% sure that I won't get sick in the future, but I know that the screening that I'm doing now will protect those around me. And I think my risk is very, 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 very low of actually getting sick in the next 21 days. But it's not zero because I was in Sierra Leone.
Well, and in saying that, you as a healthcare professional, it's very commendable because, in essence, you were actually willing to risk your life to help those people in West Africa.
Right. And I mean, one of the things that's worth pointing out, and I don't say this because of me, and I wasn't actually treating Ebola patients, which is the highest risk thing. There are hundreds of American doctors and nurses that are putting their lives on the line by volunteering to go to West Africa right now and work with Doctors Without Borders or Samaritan's Purse or other of the NGOs that are running hospitals there. And I think of it sort of like they're running towards the fire and towards the house that's burning instead of running away. They remind me of the firefighters that ran into the Twin Towers when they were, burning back in 9/11. So it really bothers me when I hear the governor and others in the press talk about, Dr. Spencer, who got Ebola, as, sort of vilify him and sort of, I think these docs and nurses are really heroes and should be respected, and their sacrifice should be honored. And when they come home, they shouldn't be mistreated and they shouldn't be unnecessarily quarantined or discriminated against. I mean, another issue that's a real issue with regards to discrimination is what's happening to people of West African descent in Buffalo, or in the States in general. People are thinking that everyone who's from West Africa maybe have Ebola, and so they're staying away. And it's just unfortunate. This fear of Ebola is causing our worst behaviors to come out, and that's unfortunate.
Now, I also want to ask you, you were in West Africa. Do you see this getting better, or is it getting worse there?
I mean, it definitely is getting worse, and unfortunately, it will continue to get worse, I'm afraid. I mean, thousands are dying now, but it could easily be tens of thousands in the upcoming months.
So do you think it will get worse to the extent that it will spread to the United States and be a very serious issue? Because you're saying right now that it's not all that serious in the United States, but do you foresee that in the future that it will become an issue?
I don't think it's ever going to be an issue in countries like the U.S. or the UK or name the country with really strong healthcare systems, because I believe that the way Ebola is transmitted, it's transmitted by very sick patients and their body fluids or their dead body. You have to be in contact with someone who's really sick.
Now, how did
through the air? And so, if you have a really good healthcare system, you can control exposure. Having said that, I believe there's a possibility it could spread to other, countries that have. Think a country, maybe in Africa, that has a very poor healthcare system and in a very urban area, and that's where, unfortunately, it could spread quickly. So the best thing the world can do right now to make a difference is throw as many resources as possible into West Africa to stop this thing. It can be stopped, but I'm not sure the world has the guts to do what's required to stop it.
Well, I'm glad I get to speak with you, because there's one question that I have that I haven't heard anyone ask or mention, and that's the topic and the subject of money, because when people from the U.S., such as yourself, go to West Africa, and there's a currency exchange.
I take U.S. dollars, but then you change them for what's called leones.
Okay.
And the leones right now, the going rate is about $1 US for 4,500 leones.
Right. So it may be a crazy question, but if that currency is circulated in and around West Africa, does that money have the potential of contamination if it was handled by someone who has Ebola?
Yeah. No, that's an interesting question. I've not heard that one before, but I would say this: what we know about the virus is that it only lives in a suppository, like a human body.
Okay.
And it's exposed to, say, the natural environment, like a floor or a chair or a sofa or an American dollar bill. Its life expectancy is like minutes to an hour. It's very fragile outside of the human host.
Okay.
So there's no way that the money coming back from West Africa could physically contaminate anyone here.
Okay. All right. Okay. Yeah, because I thought of that. I mean, if someone has Ebola and they're handling money, and they hand it to another person,
right,
then immediately it has that potential, right?
I mean, again, what I caution people to realize is that if you're really sick, you're probably not going to be well enough to be handling money. And the only people that are contagious are the people that are symptomatic and really sick. So the chances of something like that happening are very low.
Okay.
I mean, it's probably not impossible, but it's very, very low.
Okay. And if anyone is listening who has been to West Africa or had contact with someone that's come here from West Africa, can you just urge those people as to what they should do in terms of informing someone? What do you do?
Well, I mean, I think anyone that travels right now from West Africa, it's not a matter of me informing them. They're going to be informed when they get to the airport in the United States, and they'll all have to do at least the 21-day self-monitoring like I've had to do. And if it's more than 21 days, then there's really nothing they need to do. The fact that they came from West Africa in August doesn't mean anything today with regards to Ebola risk. Now, I think people should be cautious about traveling to West Africa unless they are part of the solution. It's probably not the place to go have a vacation right now, but it is if you're a doctor or a nurse or some other kind of technician and feel the urge to go, this is the time to go.
Now, are there any other places aside from West Africa that you would urge people to kind of stay away from?
No. And there's a lot of, that's again where there's so much fear coming in. Other countries people are talking about Africa like it's this country, but really it's a huge, I mean, obviously we know it's a continent and there's many, many countries. And so you don't have to worry about Ebola if you're going to South Africa or to Congo or to, I don't know, name the other country. This is limited. Nigeria had a few cases, but they've been cleared by the WHO. Senegal was cleared. It really is limited to 3 countries right now.
All right, and lastly, I'm going to let you go. I really appreciate your time, Dr. Glick. I did a blog today regarding the fact that you've come back to Buffalo after 2 weeks in West Africa and you're monitoring yourself. So I did a poll and asked people if they were comfortable with that or if they thought you should be quarantined. and it's almost 100% of people are saying that you should be quarantined. So can you address that and the people who have seen this poll and seen the blog? And, people obviously, as you have said, are living, somewhat in fear in the United States. But based on what you're saying, that's kind of unwarranted, right?
Yeah, no, I mean, I understand the fear because it's all that people are talking about. But the facts don't support that at all. It really is our ignorance, and I say that collectively, that is making people think those things. I think that, I think we should trust the CDC and the experts to make the right decisions here. I don't think we have a lot to fear here in this country with regards to Ebola, and I would urge people to. Hopefully, your listeners who've listened now will feel better now that they've heard me share. I'm not surprised by that sentiment. I mean, we definitely have gotten. You read the comment. I don't read the comment section, but I'm sure there's a lot of ugly comments out there. We've gotten some hate calls and some scary stuff, but that doesn't mean we shouldn't speak the truth. It doesn't mean that we shouldn't stand up for what's right, especially when our fear in this country is limiting our ability to be effective in West Africa. And furthermore, it's really discrimination. And so I guess I would encourage your listeners to think about it in terms of, helping the least of these, helping the most needy. What would Jesus do if he was here today? Would he run away from this? Would think about leprosy in the Bible and how Jesus was one of the few people who was willing to touch the leper. And I would say that Ebola is a lot like that, which is probably what HIV was back 20, 30 years ago. People were just afraid of fear, and it's the same sort of thing. Yeah. But we shouldn't, rational people shouldn't allow our fear to overwhelm us.
Now, Ebola has been an issue for quite some time, right? This isn't new.
You're right. I think it was first discovered in 1976. In the past, though, the outbreaks have all been in very remote villages in some corner of like Congo or some other African country, and this is the first time that it's hit this many people in really serious urban centers. The capital of Freetown has 2 million people, and now Ebola is spreading through Freetown. So it's a the scope of it, the nature of it is much different than it was before.
And another question I have for you is, now you've chosen to monitor yourself. What would be the set?
Well, again, let me just clarify that. I didn't choose this way. This is what the CDC is demanding of me. This is what my local health department is demanding of me. I agree with it. I'm cooperating, but it's not like it's up to me. I have to do this.
Oh, I see. Okay. So just on your own, this is a 21-day period. Could you on your own voluntarily say to the CDC or whatever entity here in Buffalo, I want to be quarantined just to make sure? Could you do that? And if you could, why wouldn't you do that?
It's a good question. I don't know. I probably could, I suppose. But, I wouldn't do it for two reasons. One, it's not the right thing to do. It's not what the science would suggest. I don't feel that I'm at any risk to my family or patients at this point. Mm-hmm. And secondly, I think the reason to do that would be out of fear. And fear is not what ultimately is going to help the people in West Africa. It's not what's going to change the tenor of the conversation here in the States. We have to rely on, I believe, the science and our faith, and put that in place of our fear.
Okay. I have now we can.
Why did think of any? Any civil change in our country's past. It was courageous people who decided to stand up for what was right, not doing the political expedient thing. And I sort of feel that same way about this situation. We need to do what's right for the people of West Africa.
You're a doctor at the Jericho Road Community Health Center, correct?
That's right. Yes.
And that community health center, what do you guys specifically do there? It's primarily health care. We provide health care to over 50,000 patient visits last year. About 60% of the patients we serve come to Buffalo as refugees. So really?
Many of them don't speak English. But we have two sites. We have one on Barton Street on the west side, and then we have another site on Genesee Street, which is on the east side. Mm-hmm. So we serve the community here in Buffalo, providing basic family medical care to lots and lots of underserved folks.
Now, if anyone listening has a question, is there a way to do that with respect to Jericho Road Community Health Center, or you personally?
Well, they can go to our website, jrchc.org, and I think that would be a start at least to learn more. And then I would just think, and we actually have on our website, we have a global blog that talks about our work in Sierra Leone and answer some of the questions related to that.
Okay. jrchc.org?
Yes.
And you say that on that website, under the global tab?
Yes, there's a global blog that it talks about my trip and talks about the work that we're doing in Sierra Leone, and also talks about how people can support it if they would choose to do that. We would, the folks in Sierra Leone need as much support as possible. So we support a clinic, our clinic works there and support it. We support it. So we'd be happy to take people's donations, et cetera, et cetera.
All right. Yeah, I see it here. I'm right here. So you can go to the website again is jrchc.org. And on that site, as Dr. Glick mentioned, it gives an account of everything that they've done in Sierra Leone. Even when you go to the homepage at the website, again, it's jrchc.org. There is a section over to the right where you can volunteer. You can also donate to Jericho Road, to the efforts in West Africa. So you're doing a great thing, Dr. Glick, and thank you very much for your work in Sierra Leone and trying to help the people in West Africa. It's very, very commendable, and I'm sure you'll be all right. Just want to thank you very much for your time, taking time out to speak with us, and good luck in the future. Keep in touch with us and tell us, what's going on there, and tell us about your efforts and any positive things that are going on. Be more than happy to speak with you anytime. Okay.
Thank you, Todd. All right.
All right, sir. Thanks a lot.